Well, gentlemen, thanks for joining me here on the floor of the MedTech Conference 2025 San Diego. John, as said, it's been a long time coming. Share with us the organization, the mission, and what we're looking for.
Thank you, Joe. Excited to share the National Society of Black Engineers have partnered with AdvaMed for the past 4 years to transform the floor with, one half, if not both, of the audience, which is MedTech Conference, the tech bringing engineers. The Society's mission is to promote the number of culturally responsible Black engineers who excel academically, succeed professionally, and positively impact the society.
Awesome. And how long has NSBE been around?
Yes, that's a wonderful question, Joe. They just celebrated their 50th anniversary this March, and so have been contributing to innovation, enabling physicians, contributing to industry standards since 50 years ago.
Nice.
Yeah, so
Nice.
Great question.
And you're a director there, right?
I am,
Alfred?
yes.
Share with your experience there and what you move forward within the organization.
Well, thanks for that question. And again, I love the work we do at NSBE. I am the director for the healthcare interest group, basically focusing on anything that has to do with healthcare in the innovation space. Our vision is, at NSBE is really to be the most technically sound organization that can support the Black community when it comes to complex solutions as it pertains to healthcare. Our mission, again, is to promote the development and innovation of anything that has to do with healthcare-related challenges and ensure that we can prevent, diagnose, and treat injury, illness, and diseases.
And you're also an engineer at Microsoft, is that right?
Yeah, and I cover AI in healthcare as well.
Cover AI in healthcare.
Yes.
So you're operating from a position of strength, being able to evaluate that.
Leverage both, yes.
Yeah.
Yes.
And Uday, yourself. Now that's our mission. How do we fulfill it?
Yeah, we use what we call the CARE strategy. CARE is an acronym for Connect, See, Advance, Recruit and Retain, Educate and Promote. So I can go into details if you want me to, but that's the strategy that we weave our programs to advance the mission and the vision that my colleagues have just introduced.
And you also an engineer at a CVS?
Yes,
Software as well?
software engineering.
AI as well?
I do AI too.
Okay. So we're surrounded by really smart people. So when we think about NSBE, what are the 2 or 3 biggest challenges that are ahead of you right now? And then how can this community, the engineering community and the MedTech community, be a supporter of moving those missions forward? So John, you want to handle that?
Yeah, thanks for the opportunity. Right now, especially in these times, we're seeing probably an unprecedented impact and gravity of the geopolitical climate and its impact on innovation, industry, academia, and engineers outright. So how we can conquer that challenge, there's no I in team. So you build teams of fellow engineers, the Joe Mullings, the Dr. Deepak Nath of Smith & Nephew, and you have collaborative discussions to, very similar to engineering problem rigor, right? Define the problems, set out the solution set and the alternatives, define project scope, schedule, budget, and then execute towards that. Recognizing that nothing is going to be linear, you have to plan for the unexpected. There's going to be deviations. Any good engineer subscribes to Murphy's Law. If it can go wrong, it will. And then work through it, right? I always tell engineers, especially teams, as a leader, that to fail is not a fault, right? Any development design process is iterative, right? So you need to gather the data, the lessons learned from the failure, and then fall forward and additionally upward, right? So forget, if you run into hardship, forget today, win the rest of the way.
Absolutely.
Thanks, Joe.
Yeah. And Alfred, as director, what does the membership look like? Are they young students? Are they graduated students who are in industry now? Give me a rough breakdown of what one of the members would be.
Great
like.
question. We actually have a vast membership across the collegiate space, the pre-collegiate space, so we're talking high school age, as well as the professional space. all interested in healthcare and healthcare innovation. The intention is to ensure that we have coverage in each of those spaces. We've even started the process of building what we consider small hubs in places like Carnegie Mellon and in San Diego, trying to ensure that they have an opportunity to share ideas and programs that they're working on at the collegiate level. So again, from a breakdown, we're talking about members that are already part of NSBE, interested specifically in careers in healthcare, that are looking to grow their opportunity to move from a certain level, whether it's graduate or undergraduate, into a more career professional-based solution. So.
And Uday, you probably know this, we all know this, you don't become an engineer, you're born an engineer, right? Nobody ever switched out of world history as a minor and said, I'm going to become an engineer. So when I'm thinking about this, when's the best time for me to consider membership in NSBE? And would I get a mentoring opportunity for somebody to give me some guidance?
The best time to consider membership for NSBE is today. Anyone who is interested, who is an engineer or interested in engineering, can register with NSBE today. Go to nsbe.org. There's a link to sign up for membership as a student, as a professional. And we have so many programs that can, mentorship programs, an incubator program that we have launched that would connect engineers that are interested in health tech and health innovation to funding, mentorship, partnerships to be able to take their idea into a product or a service.
Fantastic, fantastic. Well, gentlemen, I appreciate your time here today and sharing the story of NSBE. And without a doubt, I'll probably all see you on the floor next year in Boston.
Definitely.
Awesome. Thanks, gentlemen.
Thank you, Joe.
Thank you.
I'm Joe Mullings from the floor of the MedTech Conference in San Diego 2025. Be well.